blood coagulation or fibrinformation. This occurs via two pathways, the intrinsic and the extrinsic pathways, which are aided by the clotting factors. We're going to demonstrate how each of these factors play their roles in the coagulation process. Now, let's begin with the intrinsic pathway. The intrinsic pathway is activated when blood is exposed to collagen fibers underlying the vascular endothelium. This activates factor 12. Active factor 12, in turn, activates factor 11. Active factor 11, in turn, activates factor 9. Active factor 9, in the presence of factor 8, calcium ions and von Willebrand factor from platelets, activates factor 10. Now, activation of factor 10 is the beginning of the common pathway, which proceeds as follows. Active factor 10 in the presence of calcium ions, factor 5, and platelets cause the activation of factor 2. That is conversion of prothrombin to thrombin. Thrombin plays two major roles in the coagulation process. First, it converts fibrinogen, that is factor 1, to fibrin. It also causes the activation of fibrin stabilizing factor. Activated fibrin stabilizing factor stabilizes fibrin, leading to formation of a stable polymer that forms a fibrin mesh. Next, let's look at the extrinsic pathway. The extrinsic pathway is triggered by the release of tissue factor, also known as tissue thromboplastin, from damaged tissue external to the blood. It is called extrinsic pathway because it is initiated outside the blood. Tissue factor activates factor 7, and together these two factors activate factor 10. This is another way in which the common pathway is kick-started.